Hi, everybody. Good afternoon, and welcome to our discussion about nursing at Baystate Health. My name is Scott Berg. I'm the Vice President for Philanthropy and Executive Director of the Baystate Health Foundation. I want to welcome everybody for attending February 1st. Beautiful day outside, so we really appreciate you taking the time. Before we start, I just want to go through some housekeeping items. This presentation, just a reminder that this presentation will be muted. So excuse me, your microphone will be muted during the presentation and your camera will not be on during the call. We are recording this call so it can be shared with those who cannot join us today. And if you have an email address, we will send a link to the presentation. And if you're joining us by Zoom, please use the chat function for questions for our presenters, and we will answer as many as we can at the end of the presentation. And if you experience any technical issues, please reach out to our host using the chat function. I am absolutely honored to introduce our guests and colleagues on the screen. So let me do introductions separately, and I'm going to turn it over to them for the presentation. I'll start with Joanne Miller. Joanne is our Chief Nurse Executive at Baystate Health and Chief Nursing Officer at Baystate Medical Center. Joanne has more than 30 years of hospital operations and nursing excellence experience. Prior to joining Baystate, Joanne served as Chief Nursing Executive at Carson Tahoe Health in Nevada and Interim CEO, Chief Nursing Executive at Jupiter Medical Center in Florida. She was Chief Nursing Executive and Vice President of Patient Care Services at Johns Hopkins Medicine, Sibley Memorial Hospital in Washington, D.C. I want to welcome Joanne. Gina St. Jean is our Program Director for Nursing Practice and Nurse Residency at Baystate Health. Gina has more than 25 years of experience as critical care nurse and educator. Prior to her current role, she served as Director of Nursing at the William Backus Hospital in Norwich, Connecticut. And Gina's experience at Baystate has included serving as an emergency department in cardiac intensive care nurse educator and as clinical research nurse coordinator for the Department of Surgery. And finally, Katy Patrick is our Program Director for Magnet and Nursing Outcomes Improvement at Baystate Medical Center. She has been instrumental in leading quality improvement initiatives impacting the system and chairs the Nursing Quality, Safety, and Magnet Council. Katy has been with Baystate since 2008, when she joined the team as a new graduate nurse on South Wing 5. Since then, she has served as a level 4 nurse, a nurse educator, and manager of nursing outcomes improvement. With that, I'm going to turn it over to our guests, and I'm going to be off screen, and I will return after our presentation for our question and answer session. I'll turn it over to you, Joanne.
Thank you, Scott. So Gina, Katy, and I truly thank you for taking time away from your busy day to call in and spend some time with us. We thank you for your continued thoughtful and generous support and for your advocacy. We know that many of you have been active supporters for years, and we are eternally grateful to you. Much like what you've heard on the news over the past 3 years, nurses have been front and center during the COVID pandemic. More than ever, it's time to take care of our caregivers. And throughout our conversation with you today, you're going to learn a little bit more about what that means. At Baystate, we did experience the Great Resignation, losing nurses due to fatigue, burnout, and just needing to leave the bedside. We're focused on creating a new generation of nurses, inspiring our experienced nurses, and in some areas, even redesigning the care delivery model. The stark truth is that our experienced expert nurses are retiring or leaving acute care, the bedside, faster than any of us can replace them. Almost all of our new hires are novice nurses. And while it is an honor and a privilege to coach and mentor and create a new generation of nurses, it's also a very daunting prospect because of the sheer numbers of novice nurses. Currently, we have approximately 900 nursing students. That's the good news, right? 85 student nurse apprentices, which we refer to as SNAPs, and 400 nurse residents. Again, Katy and Gina are going to spend a little bit more time talking about the SNAPs. We're very acronym happy, so we'll try to go easy on you. The SNAPs and the nurse residents. And additionally, approximately 35% of our bedside nurses have 3 years or less of experience in the acute care environment. I'll just share a little story with you. So in our neonatal intensive care nurse, we have about 6 nurses who have all been at Baystate and in the NICU anywhere between 41 and 44 years. All of them, Katy and I actually met with them, said that they're going to be retiring within 18 months. So that's about 280 years of experience that we will in fact replace with novice nurses. So that's just an example of illustrates what I just described to you. So we partnering with our local community schools of nursing is our top priority. Together with our academic partners, we share the responsibility and understand the demands. The pandemic created huge challenges for both the faculty and the nursing students. So imagine flipping your direct clinical experience as a student nurse to virtual. And that's exactly what happened. So what was the result? Nursing students are graduating and entering practice needing a tremendous amount of support and clinical training. So I just want to share some data with you. I'm going to put up a slide with some numbers on it that talks a little bit about our local schools of nursing. So the schools that you see at the bottom, they graduate approximately 385 new nurses every year. They could graduate more, but because there's also a shortage of faculty, there are nursing students who apply who meet the academic preparation and criteria for admission that get turned down every year because there's simply not enough faculty. So at Baystate, we hired 205 new graduate RNs in 2022. About 140 of those graduate from one of our 7 local schools that you see on this slide. We think we can do more. We think we can hire more of the local new grads, those who live in our community and want to spend their career growing and learning and having a lot of different opportunities at Baystate. So we work very closely with the schools of nursing. We'll talk a little bit more about that in our discussion, but my esteemed colleagues, Gina St. Jean and Katy, are going to provide greater insights into our strategies to develop a new generation of nurses and to prepare them to deliver outstanding patient care. Gina?
Thank you, Joanne. Despite the challenges that Joanne outlined, Baystate nurses are incredible, and they were heroes long before the pandemic. I'm going to share with you a story and a video of one of hundreds of stories depicting our extraordinary nurses. Tony had been looking forward to his daughter's wedding on September 3rd in 2021, but 2 weeks before he was diagnosed with a rare type of leukemia and learned that he would be in the hospital on her special day. His daughter, Jillian, who is also a nurse here on our South Wing 5, decided she couldn't bear to have a celebration without her dad, her best friend, and instead was married without guests at Ashley Reservoir by a justice of the peace. On September 3rd, what would have been her wedding day, Jillian came to Baystate Medical Center with her wedding dress, and Springfield 3 oncology nurse Emily Stevens helped her get dressed in the lobby bathroom. Nurse Leanne Feeney helped Tony get dressed and bought a wedding card for him to give to his daughter. They all met in the Demore Healing Garden so that Tony could see his daughter in her wedding dress, and yes, have a father-daughter dance on her wedding day, all while he was hooked up to his chemotherapy. Emily played Half the Man on her phone, and Leanne recorded the event as they danced. Tony said, "You made it possible for us to have our moment, and we will never forget that." He said, "I felt like I had ruined her big day, and because of you and what you all did, I don't feel that way anymore. It meant so much to us that we got our dance." So we're going to play you the video. Every time I see that, I get the chills. That nurse, like many others, began her career here at Baystate. That nurse, first as a student with the Schools of Nursing, and then the SNAP program, which stands for Student Nurse Apprentice Program, like Joanne stated, and then finally our Nurse Residency program. We have 85 current SNAPs. Our goal is to double that number in the next year. Our goal is to provide these student nurses with the skills to prepare them for success as a Baystate nurse where they will provide exemplary patient care. I've been at Baystate for more than 20 years as a critical care nurse and then a nurse educator. I started my career at Baystate as a SNAP. It's where I grew up as a professional nurse, and I consider it my home. Baystate has provided me with a lifetime of opportunity, and there was no nurse residency when I started. Our nationally accredited nurse residency is 10 months long. It consists of monthly seminars, in-person skills sessions, formal coaching, mentoring, and ongoing elbow-to-elbow support. We took an innovative approach to redesign our nurse residency last year. This new approach includes 4 different tracks, and we'll show those to you. The evidence-based practice project track supports the new nurse as they select a topic of interest and research evidence-based practice related to that topic. The professional leadership track supports the new nurse as they shadow a nurse leader or attend a leadership class of their choice. The Love Your Own Unit track supports the new nurse as they develop or engage in a unit project focusing on unit culture, engagement, recognition, self-care, or a community service project. And finally, the Explore Your Professional Options track, which supports the new nurse as they complete shadow experience in another department of interest with a guided reflection after that experience. Since this redesign, our nurse resident turnover rate has decreased by 25% from previous years, with 35% of our bedside nurses having less than 3 years of experience. How do we support these novice nurses? We do this with elbow-to-elbow support. In the classroom, outside the classroom, we right-sized our nursing education team and brought on clinical education coordinators. These clinical experts are available during off shifts to support the frontline nurses with any questions or help they may need. I'm going to turn it over to Katy, who will give you greater insight into just how we do this.
Thank you so much, Gina. Good afternoon, everyone, and thank you so much for joining in today to hear our story. I'd like to start by sharing my personal journey here at Baystate Medical Center. As you can see in my bio, I have been a nurse here for 15 years, starting as a new graduate nurse fresh out of school, and over the years, I advanced on the clinical ladder through the Professional Nurse Recognition Program before becoming a nurse educator. I have experienced firsthand receiving, providing, and now overseeing nursing education at Baystate. Reflecting on my journey, I can appreciate how much more impactful it would have been to have a dedicated learning environment to practice and teach in. We have seen over the years just how essential nurses are in responding to public health crises such as SARS, Ebola, and most recently the COVID-19 pandemic, which has further substantiated our need not only for a dedicated education space, but a space on campus so that nurses ranging from novice to expert are able to quickly and efficiently learn how to appropriately respond in these times of need. So, how do 900 nursing students, 400 nurse residents, and 85 student nurse apprentices get the hands-on skills and didactic learning necessary to be successful? I'd like to share with you a photo of our current nursing education space. Our nurse educators and clinical education coordinators must be incredibly innovative in and out of this space to deliver effective teaching. This space cannot appropriately accommodate the approximately 1,500 new staff members that come through our orientation program each year. So supplemental learning is happening on the nursing units where distractions are endless. We're certainly not proud of this current learning environment. You could even say we are embarrassed. Do you want to know what we are proud of though? We are so incredibly proud of the daily letters and cards we receive from grateful patients and families. We are the proud recipients of multiple National Gold Beacon Awards demonstrating exceptional patient care. We are beyond proud to be recognized as a 4-time Magnet designated organization on our journey to a 5th consecutive Magnet designation. So proud. This recognition is extremely difficult to achieve and very rare. As of 2022, there were 597 Magnet designated organizations worldwide. I want to give you a couple of numbers to support that. So 178 of those designated organizations have received Magnet status 1 time. 124 have received it 2 times consecutively. 129 have received it 3 times consecutively. 124 4 times consecutively. And only 34 organizations have achieved Magnet designation 5 consecutive times. We will be among this elite group. And then just to go one step further, only 8 organizations have received Magnet 6 consecutive times. So you can see how difficult that is to achieve. So what is Magnet? Magnet is a representation of nursing excellence, providing excellent evidence-based care that positively impacts patient outcomes. To achieve Magnet status, we must outperform the national benchmark for nursing-sensitive indicators, such as hospital-acquired pressure injuries, catheter-associated urinary tract infections, central line-associated bloodstream infections, and falls. In addition to consistently demonstrating and providing evidence of exemplary professional practice and innovation across our great organization. The future of nursing excellence at Baystate hinges on successfully reaching our dream of providing a dedicated education space appropriate for optimal learning. I'd like to show a few photos. So what you're seeing here are architectural designs for the Center of Nursing Excellence and Innovation that were created based on feedback from nurse educators and clinical nurses who have attended orientation or other training programs within our organization. The space would contain 4 simulation bays equipped just like a real patient room, and adjacent classroom style seating outfitted with audio-visual technology and interactive whiteboards, just to name a few of the features. And there's a couple more pictures. There we go. At this time, I'd like to turn it back over to Joanne for final closing remarks.
Thank you, Katy. You know, after all this time, I still struggle with where that mute button is. So, you know, in closing, I have to say very honestly, Katy, Gina, and I do what we love, and we love what we do. And we take our responsibility and embrace our responsibility for creating a new generation of nurses that will be able to provide exceptional patient care every day, very seriously. Our current nurses provide care to you and your loved ones, and also to each other when nurses themselves and their families need nursing care. So we believe that training and education innovations that we talked about today will ignite the joy of clinical practice and enable deeper connections with our patients and their loved ones. This will play a key role in our ability to recruit, retain, and continually grow and develop our bedside clinicians for years to come. And lastly, I would like to share with you a grateful patient letter that I actually just received yesterday. So the patient writes, "The reason that I'm sending this letter to you is that I was a patient brought to your emergency room on New Year's Eve. I was unresponsive and unconscious, according to the paramedics, due to hyperglycemia and a head injury sustained in a fall. I sincerely want to thank all the staff in the emergency room who watched over me and were responsible for my recovery. I spent the most time with Nurse Margot, who was an absolute angel sent from heaven to watch over me. I could not have asked for a more compassionate and professional nurse. In fact, the entire staff in the emergency room was no less than excellent and outstanding. When I woke up in the emergency room, I had total amnesia of the event and was asking people, where was my dog? And was the dog with me? No one had seen my dog, which troubled me deeply. But the nurses called a family member and specifically asked about the dog. And the family member came to the hospital and reassured me that my dog was home, safe and sound. Would you believe that the caring staff in the hospital came by and asked on not only how I was, but how was the dog? And that speaks volumes to me about everyone I encountered. At no time was I treated impolitely, in haste, or anything less than a very important person. I am deeply grateful for the care and the treatment I received. If you can find it in your heart to do so, I would love these fine people to know how much I appreciated them for their kindness and skills. Every nurse and everyone on staff was fantastic. You should be very proud of these people. They truly represent what is good in the world.
Hey, thank you, Joanne, Gina, and Katy. Absolutely fantastic information. So what we're going to do right now is we're going to get to the question and answer portion. Just a little context. As I mentioned when we first opened I work with the Baystate Health Foundation. We are very, very proud to work with this group of nurses. I think every time they call up, we say yes. So one of our goals is to raise money so that when Katy calls up and says, hey, can we do something to support Magnet? It's a pretty simple yes. It's so important for a million reasons. So we're very happy. And by the way, the turnout for this event today is really nothing short of outstanding. A lot of times we've been doing these virtuals during the COVID era, and we're wondering, does it still hold value? With the response we got and the interest of everybody, you know, we're talking a lot of people on the screen today. And I guess that's an introduction that we have a lot of questions. So if it's okay with our guests, I'll answer some questions or ask some questions, and the group can respond, whoever's the appropriate person, that'd be great. One of our first questions, how has the pandemic affected applications to nursing schools?
Oh, I could take that one. So one of the silver linings of the pandemic is that the general public finally understood what nurses really do. Left to the devices of people who enjoy good health and the media, nurses have not always been portrayed appropriately. So I think having seen on the news 24/7 in the pandemic, nurses in action actually was helpful to us. And so applications for nursing schools have gone up, but the shortage of faculty is such that applicants who meet the criteria aren't able to enter into nursing program. Some are waitlisted and some are turned down altogether, much to the dismay of the faculty, of course. So one of the conversations we had with the deans just a couple of days ago this week was, how can we, as Baystate nurse educators and myself, become adjunct faculty and help them with their students? With the clinical and elbow-to-elbow support that we provide, it's possible that we could turn that training into credits, and that would help the student get more hands-on clinical care, and it would help the faculty that's short. So more to come on that, but it's definitely it was a very robust conversation that we had, because we have to turn that around. The other piece of it is, aside from the nursing schools, we are growing and developing our own, and that's why the SNAPs are so important to us, as well as our patient care technicians, who now see that Baystate can help them realize their dream of becoming a bedside nurse.
Thanks, Joanne. And a reminder to our guests too that are listening or on Zoom today, if you want to type in your question on the chat function, we'll try to get to as many as we can. Another question that came in, what proportion of nurse residents stay at Baystate? Do we have an idea?
I can take that.
Great, thanks.
Currently our nurse residency retention rate is in the mid 90s. About a year and a half ago, we were down in the mid 70s for retention. The redesign that we did last year and the innovative approach really seemed to meet the new nurses where they're at. You know, we have a new generation of nurses, their needs are different and their interests are different. And so we really listened to the feedback, took it under careful consideration, and that's why we developed those 4 tracks to help foster and promote professional development for them, because most of us that are nurses know that we don't always know what we want to be when we grow up as soon as we graduate. And so this helps to mentor them and guide them as they figure those next steps out.
Great. Hey, we just, again, I'm going to be, we have a lot of questions coming in and just comments, so I'm going to mix them up a little bit. One of our listeners, and I'm just going to say what they wrote. Excellent presentation. As a mom of a nursing student from American International College who had an amazing clinical experience at Baystate last semester, thank you. Thank you for working with our nursing schools to ensure their students get the clinical experience they need to become educated, skilled, professional, empathetic, and caring nurses. Baystate is such an important part of our community, and we are lucky to have such an amazing hospital in our community. Boy, if I can get something on our letterhead, that would be it. So for our guest who wrote that in, thank you very, very much.
So Scott, can I add to that? I just did rounds this morning and I was on one of the heart and vascular units, and there were nursing students there from STIC. And so I went in and said hello and, you know, welcomed them to the tribe and asked them how their clinical practicums were going. And one of the nursing students is one of our OA monitor techs who's been here at Baystate for 18 years and was just inspired by the nurses that she worked with, that she wanted to be a nurse. So she's in school to be a nurse now, and her colleagues didn't have that kind of a background. You know, they left high school and went into a nursing program, and they were just like applauding her, and they're like, she's amazing. Like, we learn from her every day. So anyway, I just wanted to share that with you.
Thanks, Joanne. Thank you. Another question that was just submitted, a little bit lengthy, so I'll just read this and then I'll let you guys decide how to answer it. Due to the fact that nurse turnover is so high, and I'm sure educators are being pulled in numerous directions, have you ever considered partnering with industry to close the gap on educational needs, especially disease and specialty-specific needs? Most reputable companies have both branded and unbranded opportunities provided by certified nurse educators. The educational opportunities are flexible and can be often tailored to a customer's needs. I'll leave it to you guys.
So that's a really good question. And there's a lot of things that we're talking about. One of the things that we're talking about are our retired nurses who've left the bedside for, you know, good reasons, but have tremendous experience and talent and skills. And they don't want to go back to the bedside, but they want to help in some way. So we're talking about having our retired nurses be available as formal mentors for our novice nurses to help them transition into practice. And that, as you were reading the question, that was the first thing that came to my mind. The other thing is we do provide a tremendous amount of flexibility. We have nurses that range in age from 21 till 75 years of age. They want and need and deserve different things. So we have nurses that want to be nurse educators. We call them nursing education coordinators that Katy is responsible for. They work 3P to 3A 7 days a week to provide support to the novice nurses. You know, it's not for everybody, but we're looking at trying to meet a lot of people's needs, and flexibility is key today, especially with the pandemic brought a lot of remote jobs. There's not as many available for nurses, but we are willing and able to look at opportunities where that just may in fact work. I don't know if Katy and Gina want to add anything else.
Yeah, I was going to bring up the clinical education coordinator role. It is a newer role within about a year and a half. And it was brought about just for that reason, to help bridge that gap with the experience complexity, newer novice nurses coming in, more experienced nurses going out. So how do we bridge that gap? So we have some really fantastic, clinically strong staff members out there who have been preceptors for years. They've been charge nurses for years. They've helped with the nursing students. And so they are kind of our liaison. They don't have a patient assignment, and they function kind of as a consult service. So anyone at any time while they're here, to cover those 3P to 3A hours, those were identified as kind of the hot spot. So they can be called at any time for help, whether it's a policy, a new product, some sort of procedure with a patient, or just to vent. Maybe they just need that emotional support, and they frequently round on the units as well. So if they're on a particular unit, a staff member can grab them and say, hey, I need help in here. And it's fantastic. And the response that we have received has been overwhelmingly positive.
That's great. Another comment, I love the comments coming in. This comes from another listener. Thank you for the presentations. I live and work in the United Kingdom and see many of the same challenges with the nursing workforce. Joint faculty appointments work well over here as well. So our message is spreading well beyond Western Massachusetts, which is always great. We have another one right here. What is the current status environment of agency travel nurse issues and expense? And how big is the pay differential between a Baystate Health nurse and an agency nurse? Something we've been facing for budget challenges lately. So
yes. So I'll start to tackle that one. So it's our reality, right? So we do have agency nurses here. We have less than we did at the height of the pandemic, but we still have them. The good news is the ones that we have re-sign up for another 13 weeks because they say of all the places they travel to, they love it here. So we end up with travelers who end up with experience at Baystate. The pay issue is an issue. I'm not going to try to sugarcoat that one. So we are, our system is very dedicated to nursing as an investment in the future of our health system, not as an overhead expense. So we are looking at the market constantly and where our nurses fall with pay. So pay has been adjusted at least probably 3 times since this past summer. And I'm sure that there's more to come. And it does cause some consternation between nurses who are travel and boastful about their pay and our nurses who are working side by side. We take that also very seriously and talk to our nurses, and we do offer incentive pay and triple bonus pay, and it's making up the difference for the vacancies. It's not a sustainable model because our nurses are already tired. It's not for everyone. Not everyone can pick up additional hours as they also juggle family responsibilities. So it's a Band-Aid that's worked. It is not the answer to the shortage. And I don't know what we would have done without them, but it can't be a model that we use forever. We'll be paying for that for quite a bit of time. So the goal is to go back to a modest number of travelers in our organization and continue to grow and develop and welcome new nurses to our organization. At the same time, making sure that our experienced nurses feel valued, appreciated, and appropriately paid. So this is a topic that is always on the table.
great. Thank you very much. Here's if you can answer this question, I think it'd be a big crystal ball. It's very short, but very difficult. How do we attract nurses to Western Massachusetts?
Can I take a first stab at that?
Oh, please.
Yes.
Well, let me tell you, I've been involved in countless interviews of clinical nurses over the years. And when we ask that question, why Baystate? They say because it's a magnet organization. So magnet, is truly nursing excellence, but it also does attract candidates to our organization. It is very, desirable to work here because we treat our nurses well. Nurses have a seat at the table. We have nurse-driven protocols. There's autonomy, and so that's really it's heightening them to the top of their license, and I think they really value that. So that's my perspective. And Joanne and Gina, you're more than welcome to add to that.
Thanks, Katie. I was going to say it's the culture. There's some very special people in this organization. And to Joanne's point, we have travelers that say they've never worked with a nicer bunch of people, and that if they were done traveling, they would stay here. So I think, the people make the culture, and the culture makes the job. And Western Mass does have a lot to offer. And Baystate is a very unique hospital in the western side of the state. And there's extraordinary learning opportunities here for any member of the healthcare profession.
I would add just one more thing to that. We are a level 1 trauma center, and that is also a big attraction. And the other thing that matters is there's really a lot to offer in this area, and we know it, and you know it. And so it becomes our responsibility when those travelers who get to experience what it's like to live here, that the Berkshires are here, the summers are great, you're close to airports, you're close to the beach, close to the mountains. That's an attraction for people. So you can work in an academic medical center that's a level 1 trauma center that's 4-time magnet. And so we have to promote that. But nurses who've never worked in any other place and come here as a traveler, they're like, holy smokes, this is a great place to work. So yeah.
Thank you all. Hey, you got during the presentation, you introduced the Center for Excellence and Innovation, for Nursing Excellence and Innovation. I know the foundation, we're just starting that conversation. So it's really exciting. I mean, it's something that makes a ton of sense for our future. One of the portion you were talking about was, I believe, that the simulation portion. What type of techniques will be taught in the simulation portion of the new center?
Sure, I can give a few examples, and then I'm sure Gina would love to weigh in. So like I mentioned, there'll be 4 separate simulation bays. We'll have, lifelike mannequins available and all real equipment that would be, right at a patient's bedside. So some of the things that we would be training staff are code blue scenarios. So how do you respond? What is your role in a code blue to make sure that we're appropriately caring for that patient? Another big thing is our hospital-acquired infections. How do we prevent those? What are our protocols and procedures around that? So it would be that hands-on training of appropriately inserting a catheter, utilizing sterile technique, and how do you maintain that catheter afterwards? So it would be a teach-back demonstration on a very lifelike mannequin, so that the staff feel really comfortable when we have a real patient in front of them. Hey, I've held this equipment before. I've simulated doing it. I know what I'm doing. Things with our IV pumps, how to appropriately dress a wound, things like that.
Some of the other things that came to mind was, some of the more important things like communication. I teach for AIC, and my clinical students are so scared when they walk in that first patient room, and I oftentimes will take them in and model how to interact with a patient, find a common theme, find a connection, put the patient at ease, and put the student at ease. And once we model that a few times, then they're more comfortable. So these simulation bays will be great opportunities for us to model communication with your patient and work through some scenarios that might come up in their actual clinical practice.
These are great answers. This is all of them, which is fantastic. Just a related question. Do you have any idea how many hospitals have already set up a similar sort of training center?
I think we're last.
Okay. And Joanne, just for people that are familiar with Baystate Medical Center, we're not looking to build out new square footage. We're looking to redo existing square footage. So from our work together, we're looking at the square footage within the Baystate Medical Library, about 2,900 square feet, right?
Yes, it's imperative that this space be on campus, because sometimes we don't have the gift of time. Like with Ebola, that was a rapidly happening situation that required very quick training and education, and it had to be on campus. So we would truly be handicapped if we had anything off campus. Plus, you know, to be able to use existing space also helps with, you know, the costs.
So we've got a couple questions that came in. I think they're related. We talk a lot about our newer nurses and the benefits of training. What are the benefits of training for our more experienced teammates, nurses? How this room will benefit them?
Yeah.
I can answer that. We provide quite a few things for professional development for our experienced nurses. We have preceptor courses that teach you how to teach and how to coach and mentor a new nurse. We also provide charge nurse classes that teach you how to handle difficult conversations, what policies you should be familiar with, and how to lead a team in a difficult situation. We also have other professional development opportunities, such as certification reviews, where if a nurse wants to get certified in their specialty, we provide certification review courses to help prepare them to take that national test. And we oftentimes are looking at bringing in speakers. We this past year brought in Donna Wright. She is a nationally recognized expert on nursing competency. And so we were fortunate enough to bring her in for 2 days, and she presented to managers, educators, and frontline nurses on how to validate nursing competency and how to approach the whole nursing education design. So we have a lot of great opportunities for that.
And
Great.
just to add to that, you know, nurses, they're lifelong learners. And with the, you know, pace that the medical field is changing even more rapidly over the last several years, there's always something new to learn. There's new technology, new products, new equipment. So really, even if you have 20 years of experience, you're definitely going to run into a new scenario that you're going to need that hands-on training.
And we have time for 2 more questions, and we're going to wrap up on time. For our group here, do you expect to see a nursing shortage in the future?
We're in it now, you know, and it's going to take some time to right size this, but I do believe that we will. I learned from my family and friends in the military that hope is not a plan. So we're very strategic about what we do. And I think the most important thing that we are doing is listening to understand, learning that the younger generation, I raised them so I could talk about them. They don't want to be managed. They want to be led. And so they're looking for strong leaders that listen to understand, and that they want to jump into the deep end of the pool immediately. You know, they don't want to wait a year to join the club of nursing. So we've really looked at things that we've had in place for a long time, like our clinical ladders, and made changes based upon what feedback we got from our experienced nurses and our novice nurses who wanted to join it sooner than we originally had in place. It was a year. After a year, you can start applying for the clinical ladder. Well, we brought that down to, if you pass your initial period of employment, which is 90 days, that you can begin the application process for the clinical ladder. So those are just some examples, but.
Well, you know, Joanne, you just answered the last question too. The future of nursing industry. I think you just answered both questions. So it's perfect timing. I'm going to wrap it up. On behalf of Baystate Health Foundation, I want to thank everybody for participating in today's call and for your commitment and generous support of Baystate in our nursing program. Just one thing to put out there. We have a unique program called Gifts of Gratitude. So if anybody ever wants to recognize somebody that was instrumental in their care, whether it's a nurse, a doctor, or somebody who works at Baystate, that's a real nice way to say thank you to the person. And those gifts actually go back to their department for spending. If you're considering a gift now or in the future, please feel welcome to contact us. I want to thank Joanne Miller and Katy Patrick and Gina St. Jean. I love working with the three of you guys and all you guys. So thank you for taking the time today. Also want to thank my team, Mal Holmes and Rania Kafuri and Kate Roberts and Jeff Ravati from Media Services for making it happen. And if there's any questions that were not answered, feel welcome to send them to me and we'll get them out to everybody. So again, thank you for everybody, and enjoy your afternoon.
Thank
Have
you,
a good day.
everybody.
Thank you.